Well, hello and welcome to Ask the Doctor. My name is Jerry McGee and I'll be the host for today's show. We're here in Pittsburgh, Pennsylvania at Wellness Associates with Dr. Eugene Goldberg. Dr. Goldberg, thank you very much for your time. Doc, on today's episode, I want to talk a little bit about this problem of bursitis, and kind of look at it from not only an athletic standpoint, but also from a everyday kind of usage, that stay-at-home mom or that that worker that does a repetitive activity. So we want to kind of make sure everybody understands all the different ways that this can happen. I'd like to address a little bit about what you found to be an effective treatment. What people can can expect, maybe a little bit about what the signs and symptoms are. A lot of people might have it right now, not truly understand it, and we want to talk a little bit about that. So what can you tell us about this thing of bursitis?
Basically, it affects your shoulder, affects your elbow, affects your knee, affects your hip. A lot of times people sit in a football game on a Friday night. They're sitting in what is called the ischial tuberosities. So if you sit a lot on your hips, you can get bursitis there. Of course, it's the knees. You're at home and you're scrubbing floors. You get what's called handmaid's knee. Okay. Of course, the shoulder, baseball pitchers get that. You can get it from, God forbid, you fall on your shoulder or you're lifting heavy objects. That can inflame the bursa. It's a fluid-filled sac, so you can inflame it. Also, the elbow, of course, the classic is tennis. You can get bursitis from tennis, from just even vacuuming. You can vacuum. You use a lot of patients vacuum and they get bursitis. So those are the common things I see. It's like the knees, the shoulders, the hips, and the elbows.
Okay. Now, looking at this from a treatment standpoint, I would imagine that it's a lot like a lot of the other problems we talk about. You might have the actual bursitis here in the knee, but it could actually be being caused by above or below that problem.
It could be coming from the kinetic chain. We believe anything can cause anything. Anything can cure anything. Of course, your hips, pelvis, low back can relate and refer to the knee. Of course, we can adjust the knee with the impulse. You get tremendous results with that. It stimulates what is called the mechanoreceptors. If there's any pressure on the nerve, we align the bone. We can adjust the knee. That takes pressure off the nerve. Just as you have a rule of thumb, Jerry, if you're ever having any pain, pins and needles, numbness or burning, your lower extremity, upper extremity, your spine, it's coming from pinched nerve. That's what we treat. Okay?
Now, when somebody's looking at, because I know we've seen some problems where if somebody was to fall on their knee, they can experience that immediate
puts pressure,
or get an immediate swelling, or on the elbow, things like, and even and let me know what you think about this. But I know a lot of people, males in general, who carry these big wallets.
Definitely.
And they're sitting on that same wallet the whole time.
I'll tell you what the research on that is. If you sit on a wallet, and let's say you have a stack of bills on the one side, what that's doing, Jerry, that's causing an ischial lift, okay? And the research shows that every muscle on that side immediately goes weak because your body doesn't like that. So you want to sit even Steven. In fact, there was a funny Seinfeld episode where George, he was sitting on a wallet and he got tremendous pain and he removed his wallet and the pain was gone. Now,
that was quite a wallet.
Yeah, but it's funny, but it's true.
Right.
It's actually true. So you don't want to sit on anything because that causes an ischial lift because, again, you sit on your ischial tuberosities.
And a lot of these things I think a lot of people don't look at, and that's what I like about the way chiropractic treats this. They're looking at what are all the potential causes of that problem. Looking at their the ergonomics.
Yes.
Maybe they're doing something just repetitively. It doesn't have to be tennis. It could be on the job and you're constantly doing something with the elbow, opening things. There's a lot of different causes to this problem, and just going in and treating that with an anti-inflammatory or a medication never truly goes and looks at what the real problem is.
Well, so there's a lot of causes, there's a lot of cure. So
Right.
It isn't just we give you a shot of cortisone. We can do acupuncture, we can do massage, increases circulation, promotes healing. We can do physical therapy, we can do chiropractic, we can do nutrition. I'll just tell you right off the top of my head, in my experience, there's a thing called hyaluronic acid. There's a thing called glucosamine, shark cartilage. These things rebuild cartilage and rebuild bone, okay? And there's no side effects to it, okay? When you get a cortisone shot, I don't know if you noticed, Jerry, that can actually destroy your soft tissue. Yeah, it gives you the relief, it's an anti-inflammatory, but then there's a side effect. When you do nutrition, chiropractic, massage, acupuncture, the good news is we can heal it, but there's no side effects.
Yeah, and I think as always, the biggest thing that people need to look at is you always want to find out what is the true cause of the problem. Don't just treat the individual problem. There's something caused that.
My comment on that is you can't really fix anything unless you know the cause. Let's say you're a plumber and you're trying to fix your plumbing. You can't fix the plumbing unless you know what the cause of the problem is. It's the same thing with your body.
Yeah, I think too many people are into this quick fix. Give me something to, control the pain right now. Then they wonder why they almost get into this vicious cycle where, they just keep having problems over and over and they don't understand it.
If you had a red light on your dashboard on your beautiful new car, would you treat the red light or would you look under the hood? What would you do?
Yeah.
That's what they're doing.
Right.
They're treating the red light.
Yeah. Or either, what they're doing, they're putting that tape over the red light so they don't see it,
You're suppressing the symptom.
Yeah.
You're not treating the cause of it.
Yeah.
So that's what we do different.
Yeah, there's a ton of things that I think you're going to find that chiropractic does a lot different than anything that you're used to. If you've dealt in the normal medical arena for bursitis, you've gone in, as Dr. Goldberg said, and had the basic treatment. It's almost like a cookie cutter approach to it. Okay, you got bursitis, you get ABC. Right? It's not really looking at the individual and trying to find out what is the the real cause of that problem. So that's one of the things that we really and why we encourage you to come down and meet the staff and meet Dr. Goldberg is because it is a unique approach. So if you've been dealing off and on with the bursitis of the shoulder and been treating it only with medication, you owe it to yourself to come down, meet Dr. Goldberg, get an evaluation done, meet the staff, see the environment that's here, and really understand the benefits that you'll see because you're treating the true cause of the problem.
You've heard of second opinions, of course. Yeah. We want to mention that there's a thing called second opinion. Like when you come in and get a second opinion, the good news, Jerry, I'm going to give you a conservative second opinion. I'm going to give you an opinion on what chiropractic, nutrition, acupuncture, massage you're going to need, not what drug you're going to need.
Right.
So that's how we do. We change the prescription. When I say change the prescription, I mean chiropractic prescription.
Well, when you talk about this thing of second opinion, I have an interesting thought on this whole thing because a lot of times, and I've gone to doctors in the past where you go in and if you ask for a second opinion, they almost get hostile.
Really?
And my advice to anybody is if you ask your doctor or tell your doctor you're going to go get a second opinion and they take a defensive approach, you definitely need a second opinion.
That's right.
Okay, because I don't think they're totally sold on what the treatment plan is that they've got. They're afraid of what a second opinion is going to tell this person.
The whole point of the second opinion is to benefit the patient. See, the patient, the whole purpose of these videos and Dr. Oz is to get the information, to give the people the options to get you a benefit.
Yeah.
If you're just doing cortisone shots and it's not helping, you say, what should I do? Should I do chiropractic, massage, nutrition? They'll tell you don't do that.
Right.
See, that's wrong.
Yeah. Yeah, I think that, when you take a look at this concept of chiropractic care, you guys aren't afraid to kind of work in this team environment,
right.
Work in conjunction with, I think everybody's healthcare could be so much better if everybody in the medical profession would work like this, where it can be more of a team. And I know a lot of people that are watching this, they've got a dentist, they've got an eye doctor, they've got a regular doctor, and they've got all these different medical professionals that having a regular chiropractor that you visit needs to be a key tool in that toolbox as you treat your overall health.
Because it's a holistic approach. Speaking of toolbox, we don't just have a hammer. We have a screwdriver, a saw, a Phillips, a wrench, and a blowtorch. We don't just do one thing. It isn't one cause, one cure. It's many causes, many cures, and we have that option.
Yeah, and so don't be afraid to look at that second opinion, excuse me, and go out and kind of take charge of your own health. I think that's really the most important thing. Don't feel threatened by your doctor. If he says, say, you don't need I wouldn't go see a chiropractor, you need to go see one. All right, and just kind of, you be the judge of that. Don't be kind of forced into something that's not in your best interest. What chiropractic care does and what Dr. Goldberg specializes in is taking the care of you as the main priority. It's not about treating your insurance company or anything like that. It's about treating you. And I think that's the greatest thing that Dr. Goldberg can offer, and you'll see that the first visit you have here. And I encourage you, if you have any questions about Wellness Associates and Dr. Goldberg, visit the website at AskDrGoldberg.com. Click on the reviews that are there. See what other people are saying. That to me is the best tool for anybody to take a look at. Got a lot of great people there that are saying some tremendous things about what has happened for them here at Dr. Goldberg's office. And a lot of those people have been under regular medical care, we'll say, for a while, and didn't have the results and came here and in a very short period of time had great results. So, start taking charge of your own health. You'll be amazed at how much better you're going to feel. So, with that, thank you very much for watching our show today. We, again, hope you find this information to be very valuable as you gain more education on your health and lifestyle. And again, we just encourage you, pick up the phone, call Wellness Associates, set up an appointment and come down. Dr. Goldberg offers a free new patient evaluation, so it's a win-win. You can't go wrong by coming down and seeing what he can do for you. So thank you very much for watching. Be sure to check back. We got a lot of great episodes coming up this month, and a lot of things that I think you're going to find very, very interesting. So thank you very much for watching, and just have an awesome day.